Let's begin with the topic brain abscess. And in the first section of our lecture, we will talk about what is brain abscess, how we can define brain abscess, what's the epidemiology of brain abscess, and also very important, what are the causes of brain abscess, what's the etiology of brain abscess. So the definition of the brain abscess, a brain abscess is a focal suppurative infection. So abscess is a suppurative infection in which there is a formation of the pus. So suppurative infection within the brain parenchyma, typically surrounded by a vascularized capsule. So the abscess is the collection of the pus which is surrounded by a capsule or the wall. So in this case, brain abscess is a focal suppurative infection within the brain parenchyma which is surrounded by vascularized capsule. That's the definition of the brain abscess. Cerebritis. Cerebritis is the inflammation or infection of the cerebrum. Cerebrum is the largest part of the brain, that's the cerebrum. We have the right and left cerebrum, and it is divided into different lobes. We have frontal lobe. That big part is the parietal lobe. So frontal lobe is on the front, then this hole between the occipital and the frontal lobe is the parietal lobe of the cerebrum. That's the occiput or occipital lobe on the back. And then the temporal lobe. So cerebrum is divided into 4 different lobes. Cerebritis is the inflammation of the cerebrum. Describe non-encapsulated brain abscess. So in cerebritis, there is abscess, brain abscess, but it's non-encapsulated. So we have 2 definitions actually. One is the abscess suppuration with vascularized capsule, and then we have cerebritis in which there is brain abscess. Suppurative lesion is present, but it is without the capsule. Epidemiology of the brain abscess is uncommon intracranial infection. This is the abscess you can see in the brain, but it's an uncommon infection of the brain, not very common. Incidence, how common it is 0.3 to 1.3 in 100,000 persons per year. So as we see, the incidence is not very high. It's not very common disorder, just 0.3 to 1.3 per 100,000 patients per year, persons per year. Predisposing conditions that can lead to the brain abscess, we have otitis media and mastoiditis that can spread to the brain and cause abscess. Paranasal sinusitis and dental infections, pyogenic infections in chest or other body sites, and we have penetrating head trauma or neurosurgical procedure. So all these different conditions can lead to the brain abscess. Any localized infections in the paranasal sinuses, in the middle ear, in the mastoid, they can spread to the brain and cause brain abscess. Again, it is not a very common condition. The incidence is only 0.3 to 1.3 per 100,000 people. Most common cause of brain abscess, if it develops, is tinea solium, which is neurocysticercosis. So that's the commonest cause of the brain abscess, which is the infection of tinea solium. Next, the pathogens. What are the different pathogens that can cause brain abscess in immunocompetent individual patients who are immunically or their immunity is strong enough, they are not immunocompromised? We have the causes are streptococcus, can be anaerobic, aerobic, or streptococcus viridans in 40% cases. Enterobacteriaceae, which are Proteus, E. coli, Klebsiella. Anaerobes, we have bacteroides, Fusobacterium in 30% cases. Staphylococci, just 10% cases. So those are some microorganisms that can cause brain abscess. Other organisms are the nocardia, can cause abscess, Toxoplasma gondii, Aspergillus, Candida species, Candida neoformans. So these are some other microorganisms besides the common one that can also cause brain abscess in immunocompetent individuals. Now let's go over the etiology. Here you can see the picture of the brain abscess that is encapsulated. So abscess is the formation of suppurative lesion. The brain abscess may develop from direct spread from contagious cranial site of infection, paranasal sinuses, otitis media, mastoiditis, dental infection, following head trauma or neurosurgical procedures, hematogenous spread from remote site of infection. So the causes of brain abscess can be spread of infection from the local surrounding structures and also from the distant sites. When the infection spread from the distant site is mostly due to the blood, or it is hematogenous spread when the septicemia occur, or when the infection is present in the bloodstream, and when the blood flows it carries that infection to different organs of the body. Up to 25% of cases are cryptogenic brain abscess. Also, 1/3 of the brain abscess is associated with otitis media, mastoiditis with cholesteatoma. Otogenic abscesses otogenic abscess is in temporal lobe, 55 to 75% of the cases, cerebellum 20 to 30%. So again, different infections from different areas can spread to the brain and cause brain abscess. Also, the common organisms, we have streptococci, bacteroides, pseudomonas, haemophilus, and enterobacteriaceae. These are some common microorganisms that can cause brain abscess. In this also you can see the formation of the abscess. Direct spread of infection can occur from frontal, ethmoid, or sphenoidal sinuses. There are sinuses present around the nasal cavity known as paranasal sinuses. Infection of these sinuses causing sinusitis can also spread to the brain and cause brain abscess. And then dental infection also can progress to the brain, usually in the frontal lobes. Here you can see this is the formation of the abscess, present of the abscess. 10% of the brain abscesses are associated with paranasal sinusitis in young males. Organism causing abscess in this case, associated with paranasal sinusitis, we have streptococci, Streptococcus miliaris. Haemophilus species, then we have Bacteroides, Pseudomonas, Staphylococcus aureus. So these are all the organisms that can cause abscess in the cases of paranasal sinusitis. Cryptogenic abscesses develop as a result of dental infections. You can see the cryptogenic abscesses. Common pathogens that can cause cryptogenic abscesses are the streptococci, staphylococci, and bacteroides and fusobacterium. Then the hematogenous abscesses, the brain abscesses that develop as a as a spread of the causative organism by the bloodstream. We have the 25% of brain abscesses are as a result of hematogenous spread. Multiple abscesses develop, often 50% have hematogenous origin. Predilection for territory of middle cerebral artery in multiple abscesses at junction of gray and white matter. Often poorly encapsulated, microbiology depend on primary source of infection. So whenever multiple abscesses are present, then it's mainly due to hematogenous spread. There is mostly at the junction of gray and white matter, they are poorly encapsulated. Here you can see, in this case, the encapsulation or capsule is missing. So in these cases, capsule is not present. Next, the abscesses linked with pyogenic lung infection and lung abscess or bronchiectasis. So lung abscesses and lung infections, bronchiectasis can also cause the brain abscess. Due to streptococci, staphylococci, bacteroides, and fusobacterium, enterobacteriaceae. So these are all the microorganisms that cause the lung abscesses, bronchiectasis that can spread to the brain and cause brain abscess. That's the appearance of the brain abscess. Next, the brain abscess following penetrating head trauma or neurosurgical procedure. So if there is head injury in different conditions like roadside accidents or any falls or injuries, or when some surgeries are performed on the brain, usually it can cause the sometimes brain abscesses. Frequently, these abscesses occur as a result of methicillin-resistant Staphylococcus aureus, epidermid and enterobacteriaceae, Pseudomonas, and Clostridium. So these are the microorganisms which are associated with brain abscesses after trauma or injury. Enterobacteriaceae, Pseudomonas aeruginosa cause of abscess associated with urinary sepsis, or if there is urinary tract infections. Next, congenital cardiac malformations like right to left shunt, tetralogy of Fallot, patent ductus arteriosus or PDA, atrial and ventricular septal defects. Allow blood-borne bacteria bypass pulmonary capillary bed, reach the brain and cause abscesses. So these are some congenital malformations that can also lead to the brain abscess because the blood bacteria, they bypass the pulmonary capillary bed and then they can access the brain easily and cause abscess formation. How congenital cardiac malformation, they can have decreased arterial oxygenation and saturation. So blood is not oxygenated very well, then it can from right to left shunt, polycythemia develop, cause focal areas of ischemia, when there is ischemia, as a result of congenital cardiac malformation, that ischemic site provide a site for the growth of the bacteria or microorganism. And this can cause brain abscess. So congenital cardiac malformations is another mean by which brain abscess can form. Streptococci are most common pathogen in this setting. That concludes the section 1. Thank you for watching sqadia.com.